All right, so I trust you had a good break. We know it was not a long break, but I believe you made the best use of it. And so we're getting ready now, wrapping our minds around moving into the next session. And we've had so much information being shared in the morning session that we really are very pumped for this afternoon session. Lots and lots to come in terms of information. So we want you to make sure that you have those notebooks out. Before we took the break, we did have a giveaway, and I am going to open with giveaways in just a bit. But let me just say a big thank you to those of you who participated a little bit earlier on. And we have a winner of the Flow credit. We say congratulations to Roxanne Edwards Chambers. Roxanne, congratulations to you. We didn't see anything posted to say someone had won that Digicel credit. And so we want to, if you did add the credit, please let us know. If no one has won, we will just do the numbers again. Because of course, the way the credit works is that if somebody got it, it won't go through anyway. So we'll repeat those numbers if we don't get someone dropping in the chat to say that they have won. While we're waiting for you all to get ready for the panel discussion, we just want to highlight our sponsors. The Public Sector Modernization Division, PSMD, Ministry of Finance and the Public Service, and the RGR Gleaner Communications Group, Platinum sponsors. Gold sponsors, Jamaica National Commercial Bank Limited, and Bank of Nova Scotia Limited. I was going to say JPSCO. JPSCO is in the silver category. VM Group, also in the silver category. The National Housing Trust in the silver category. JMMB Group in the bronze category. We also have National Health Fund, Guardian Life Jamaica, Jamaica National Group, Bert's Auto Parts Limited, the Tourism Enhancement Fund, TEF, the Bone and Joint Center, JN Fund Managers, and we say thanks as well to Terrence Lawrence, and we have some very strong partners as well. The Jamaica Cultural Development Commission, JCDC. We also have the Private Sector Organization of Jamaica, PSOJ, Rhythm FM, and the Caribbean Center for Organization Development Excellence Limited, CARICODE. And so, ladies and gentlemen, as we welcome you back for this session, we are going to be moving into our panel discussion. But before we do that, we have some giveaways. I want to keep Danny and Mike. I know that I'm giving you some time to get those wheels ready. Dwayne has advised me that we have some baskets to give away. We have some gift baskets to give away. But before I do those giveaways, let me give you the number for the credit for Digicel that we had shared just ahead of the break. All right, going to see if I can go a little bit slower this time. Are we ready? 858 847 090 096, and we round out with the number 8. So that's it. And please let us know if you have won. And now I'm going to ask Danny or Mike to bring up that wheel, because we want to give something away. And you see how nice we are? We're not even asking you to do anything for it. We're just giving away because we feel so good that we're able to do this. And so let us see what we can give away now. Do we have that wheel? Yes, we're bringing up that wheel. And we are giving away a gift basket from Caribbean Producers Jamaica Limited, CPJ. So that's a gift basket from Caribbean Producers Jamaica Limited, CPJ. Danny, spin that wheel for us. Okay, so the first name that pops up, Khadija Fudel, and I hope I have that right. Khadija, let me stick with Khadija because at least I know that. Khadija, congratulations to you. Please let us know in the chat if you're on so that we can get your particulars as well. I think they would already have it, but congratulations to you. And we also want to say congratulations to the Digicel winner as well, Janelle Nelson. So Janelle just won that credit that we gave away. So clearly we didn't have a winner the first time around. I want to as well give away something from CARICODE before we move into the session, before I introduce our moderator for the panel discussion, who will introduce the members of the panel. And so let me give away something from CARICODE. I have something from JAXA that I will give away a little bit later on, but we're going to give away now one coaching session from Caribbean Center for Organization Development Excellence Limited, CARICODE. And you heard Leslie Leafook talking a little bit earlier about how they're using up the AI over there. So let's go. Spin that wheel, Danny. Right, and you say congratulations to Merrick Cousley. Congratulations, Merrick, and of course you will get the details in terms of how it is that you're going to be able to access that coaching session from Caribbean Center for Organization Development Excellence Limited, CARICODE. We have more to give away, but we really want to ensure that we get the ball rolling in terms of the next session. And we want to say a big thank you to Caribbean Producers Limited, CPJ, for the first basket that we're giving away. We have another one from them, but we're not going to give that away right now. We're just doing two in the interest of time. And so, ladies and gentlemen, now that you have settled yourselves back in to your seats to get the rest of the information that we have to share with you, it is important that we tell you who our moderator is, because our moderator is going to be introducing the guests in the panel. And so Cheryl Bridgman has over 30 years of experience in the general insurance industry at various levels. Ms. Bridgman possesses a wealth of expertise. Her comprehensive background includes proficiency in customer service, general insurance operations, sales and marketing. And Cheryl is driven by a passion for service excellence and demonstrates a robust foundation in customer service and people management. Currently serving as the Chief Executive Officer of Caribbean Assurance Brokers Limited and formerly as the Vice President Customer Experience and Marketing at Guardian General Insurance Jamaica Limited, Cheryl leadership and strategic acumen have been invaluable. Ms. Bridgman holds the esteemed positions of a board member of the Jamaica Customer Service Association, chairman of the board of the College of Insurance and Professional Studies, and an executive director of Caribbean Assurance Brokers Limited. Ladies and gentlemen, please make welcome Cheryl Bridgman.
Thank you, Althea. Thank you. I'm going to stop telling everyone how long I've been in the industry. I don't like how it sounds. I'm only 21, but thank you for that lovely introduction. Mrs. Ilsa DeVerney, founder, Dr. Ensambe Jadia, or devoted lovely chairman, Mr. Richard Rowe, or gentleman or deputy chairman, Miss Georgette Thompson, or president, founding members, board directors, and executive officers of JAXA, staff of the Public Sector Modernization Division in the Ministry of Finance and Public Service, presenters, hosts, moderators, or partners and sponsors of Conference 2024, members of the media. Ladies and gentlemen, good afternoon, and as Althea said, welcome back. I'm sure everyone had a scrumptious lunch, and what an informative and exciting conference so far. The honor is all mine to moderate the first and most exciting panel discussion of this year's conference. My panelists today will be discussing artificial intelligence in healthcare, a paradigm shift towards service excellence, something that it's coming, it's fastly in the first worlds, and Pretty soon, it's going to reach the Caribbean and certainly in Jamaica. Firstly, I'd like to introduce Dr. Navi Muradali. Dr. Navi Muradali is a medical doctor with over 20 years' experience in medicine and digital health technology. He's the former medical director of HealthNet Clinics and served as the city medical officer of health in San Fernando, Trinidad. Dr. Muradali is now the CEO of Patient Connect, a digital health company in the Americas, focusing on AI-assisted wellness apps in the Caribbean and Latin America. Another of our panelists, the lovely, the dynamic, the energetic Dr. Janice Simmons Fisher. Dr. Simmons Fisher is a clinical director of Bioregeneration Integrated Medical Center, which is an innovative and cutting-edge healthcare facility specializing in therapies and advanced medical treatments that place a special focus on regenerative medicine, overall wellness, and longevity. Her protocols involve the use of technology, lifestyle, and biological therapies, and include stem cells, platelets, and other growth factors used to promote faster healing, as well as erectile dysfunction reversal, peptide therapy to address various health concerns, and an integrated weight loss program. Dr. Janice Simmons Fisher, who is a graduate of the University of the West Indies, Mona School of Medicine, also holds a Doctor of Natural Medicine degree from the Pan American University in plant-based therapeutics. Dr. Fisher is also a trained medical tourism facilitator with the World Medical Tourism Association. And by no means least, Dr. the Most Honorable Carey Ford. Dr. the Most Honorable Carey Ford trained in medicine at UWI, Mona Keyville, and completed training at UWI in internal medicine. Currently, Dr. Ford is the Executive Director of Clinical and Diagnostic Stewardship, Consultant Internal Medicine, and Infectious Disease, also with responsibility for several departments, including patient relations. He has worked regionally as an external consultant with WHO, CDC, and CARPHA, Caribbean Public Health Agency, in the evaluation of regional hospitals in infection prevention and control practices, and in the development of the antimicrobial resistance programs. That was a mouthful. In 2021, he was awarded Barbados' highest national award for his work in COVID-19. And that's why I say this panel discussion today is definitely going to be the most exciting. First up, please help me to welcome Dr. Jan. Dr. Janice Simmons will do her presentation, and then we'll go into a lively discussion with all our panelists. Dr. Jan, the floor is yours.
Thank you. Good afternoon, everyone. I'm really excited. Thank you so much for that lovely introduction, Shirley. I'm really happy to share today on service excellence and to really take a deep dive into artificial intelligence in healthcare. So let's take that journey together. So there is no doubt that artificial intelligence is the future of customer service. And we're all sort of familiar with, let's say, the use of artificial intelligence to automate mundane tasks like answering service, like AI chatbots on websites. But artificial intelligence also curates sort of a very unique user experience that can allow a lot for brand loyalty. And how I see it is that it allows employees to focus on those high value tasks. So it gives the customer service agents just the tools so that they can do their jobs easier, better, and with far less stress. Now, in medicine, we've always seen it as additive technologies. So in the olden days, we'd have a physician alone. And then at some point in time, there was this breakthrough discovery of what is now a stethoscope. And of course, that allowed the physician to do more, to get better accuracy in hearing the heart, the lungs, the gut. And further to that, we had the x-rays. And we all know that the x-ray gives us this information that without cutting somebody open and having, open them up to infections, hemorrhage, and death, we wouldn't otherwise be able to see. Now we're looking at functional MRI, seeing the brain in motion, and we're using robotics from large-scale manufacturing to very small precision surgeries. So let's take a deeper look. So what really is artificial intelligence? So artificial intelligence is the field of developing computers and robots that are capable of behaving in ways that both mimic and go beyond human capabilities. So all the AI-enabled programs can analyze and contextualize data to provide information or just automatically trigger reactions without human interference. And of course, healthcare really is the maintenance of health by prevention, diagnosis, and treatment, illness, injuries, whether physical or mental, in human beings. So we put them together and we see that AI is really transforming how we deliver healthcare, basically enabling faster diagnoses, personalized care, and just continuous service improvements. At our facility in Kingston, we employ AI in a number of areas. And two that I'd like to look at would be our electronic medical record system that has an AI-powered concierge. And that is able to really have personalized and timely communication with patients, thereby improving patient engagement, improving conversion rates, and customer loyalty by really just automating consistent and meaningful conversations. We use a Pinoe breath system that analyzes breath metrics and AI to look at your biological age, your metabolism, your fat burn, things like your oxygen utilization. With such clinical grade precision that we can optimize weight loss, we can optimize athletic performance, we can optimize longevity. So what are the various types of AI that are used in healthcare? We want to just look at 4 at the moment. So there is what we call machine learning, where the AI is able to interpret some of the symptoms that you have to even predict the onset of a new situation or a new illness, and to also look at how you are responding to treatment and decide if there is supposed to be an additional follow-up or that the treatment is not going to course. And of course, we know that we can have these wearables that can be more or less integrated with your physician's office. And your physician can be aware that you're having an abnormal heart rhythm in the middle of the night. It can trigger, let's say, an ambulance to the area, can trigger a call to your family. So machine learning is looking at your data and looking at what is usually normal for you in this situation and when you're stepping out of the door. Then we have machine vision, and it's basically the machines looking at and reading images. And machine vision can even correct, let's say, low resolution CT scans into high resolution ones, can automate reports, we can track tiny tumors. And we're even able to look at your ECGs, your X-rays, your echocardiograms, and with such precision that it could rival a board-certified specialist. That allows us and physicians in the field to be able to bring care and to access earlier diagnoses when a specialist isn't present. And just like some ECG machines will provide an interpretations, we have echocardiograms doing that now. We have ECG, we have X-rays doing that. And it really allows faster access to specialized care. Things like the natural language processing that AI brings allows us to do a lot of voice dictation. So we do a lot of voice dictation in our practice. We can look at the notes and we can agree or not that this is what was done. And of course, robotics. I'll talk a little bit more about robotics. It's a big area of healthcare, especially large drug manufacturing and surgical procedures. In fact, some of the robotics have reached a place that a doctor in Belgium could be performing a procedure in Jamaica, or at least assisting in one. So, looking at the paradigm shift in healthcare, we see where we have improved diagnosis and treatments, where AI-driven tools offer faster diagnosis and sometimes more accurate diagnosis. What it's doing is reducing human errors and improving the patient outcomes. We look at enhanced patient engagements, and even in COVID, where we had to all find these digital platforms. Sometimes it was a branded telemedicine platform. Other times it was a Google Meet or Zoom. But we were able to continue care of very ill patients, to offer even physical therapy, to offer counseling, and to really continue business meetings online. So these applications, a lot of them are AI powered, that allow us to really look at things, to compare things, and to really continue care. And of course, we already know that streamlining the administrative tasks can lead to shorter waiting times, but really also more personalized care. So one of the big areas that AI shines through for service excellence is predictive analytics. So AI can consume very large data, real big data, and we can look at somebody's entire genome, look at their entire blood chemistry, look at their metabolic pathways, and converge all of this data into a few really useful dynamics to predict outcomes such as heart attack, possibility of Alzheimer's, possibility of various conditions. And sometimes saying, oh, there is a possibility that you will have Alzheimer's, and that possibility is 20%, and it may happen between 65 and 69. So it allows us to do a number of predictions, just looking at general data and sometimes allowing earlier intervention, and definitely trying to reduce those complications by intervening early. And of course, the 24/7 care that we can get with some of the chatbots. It's really important that somebody can access care 24/7 for healthcare, and that data can be sent to relevant hospitals when necessary. And of course, we can basically tailor treatment plans in a very personalized way, because artificial intelligence is able to hold such large data, but to also take it against the background of what you are doing now and what has happened to you in the past. So I want to look at a few examples, and this is just one of an X-ray that's being read and the finger that has an issue being highlighted. And of course, this is a robot who is working in drug manufacturing and just really accelerating efficiency and productivity here. And I don't know how many are familiar with the Da Vinci system. It's a robotic surgical suite. And I've had to send patients for robotics using the Da Vinci, and I'll tell you at least two scenarios where I thought it really stood out for me. For a lot of our patients with prostate cancer, one of the possible complications of surgery is nerve damage, and that leads sometimes, or quite a bit, to erectile dysfunction. And the thought of erectile dysfunction will prevent a lot of men from undergoing surgery and accessing care. So the idea for us now was that with the advent of the Da Vinci system, we're able to reduce the incidence of nerve damage and, as a result, erectile dysfunction significantly. And these are multiples compared to, let's say, open surgery. And for a lot of patients who are young or who this is really such a dramatic possibility for them, the Da Vinci system prevents that complications most of the time. I also can think of a patient who had chronic renal failure on dialysis. So his kidneys had failed. He was on dialysis, already have a very low blood count, so wouldn't be able to withstand the blood loss. And that can be quite significant with the open prostate cancer surgery. And so he had the Da Vinci system. Blood loss was insignificant. He was able to do his dialysis the next week and was mobilized out of hospital within 2 days. So the robotic system gives us such precision that we're able to avoid a lot of the complications, not just nerve damage, but blood loss. And we're able to just really improve quality of life, improve patient outcomes, and just long-term improve your longevity. So we look at this idea of personalized medicine, we look at data management. Now, our electronic medical record system kind of, I would say, has stepped in to reduce a number of the issues that we had with records management. And so many of us have been to a facility, and the idea that our file wasn't on hand or it was some other department would have prevented care. And with the electronic medical records, patients oftentimes have their own patient portal. They can log in and they can take down their records. They can share it with any physician. They can share it with a hospital. And it just makes the quality and the continuation of care seamless. Communication, not just using chatbots, but using the telemedicine platforms, have really given us tools that we can really look at and say that it has been able to streamline who we need to bring in office in COVID and who we can treat remotely. But the whole idea of transforming patient experiences, such as just the robotic systems that can prevent some of the complications, we're fostering innovation and we're elevating standards. There is a smart hospital in Japan that came out during COVID, and a number of services in customer service, in triage, in even doing the vital signs have been automated. They have robots that are interacting with children and just providing some sort of stimulation and engagement. And what it allowed was that the doctors would have way more time with their patients. So the benefits for AI in service excellence, especially healthcare, has a lot to do with efficiency for me, access to specialized care, and of course, as you automate things over time, there will be cost reductions for the end user. So for us, I think we should embrace AI in healthcare to create more efficient, accessible, and patient-centered medicine. So I think this is an area that we can leverage to raise the bar overall for healthcare. And with that, I thank you.
Wow. That session, as Marie says, was certainly very gripping. Thank you so much, Dr. Jan. I didn't know that. I didn't realize that AI is actually here and that there's so many benefits of AI. You spoke about the patient care that definitely will be improving, the administration, seamlessness, efficiency. I don't have to sit in a doctor office and wait until they go through 600 files to find mine anymore. The cost savings, certainly with efficiency will come cost savings, and overall it just improves longevity. So I'm going to jump right into some questions, and I'm going to start with Dr. Jan. We're going to take questions from the audience as well. No, I'm going to give Dr. Jan a break. I'm going to start with Dr. Ford. So Dr. Ford, I know Dr. Jan alluded to just how it improves, and we just spoke a little about it. But do you have anything to add on how artificial intelligence in healthcare can be used to further improve customer service and standards, especially at our government hospitals?
Okay, great. First, I'd like to thank you, you guys, for inviting me to this presentation. I think Dr. Simmons Fisher has said it all in her presentation for most part. What I would like to say, though, is I think if we're going to really embrace artificial intelligence within the sphere of the Caribbean, one of the initial things we probably need to go back to doing is to really look at the concerns, benefits, and how it will be integrated into our systems. I think that's probably where we need to start, given a lot of anxiety about AI and probable impact in terms of doctors and nurses' care, etc. And that will mean that we need to go back to look at how we're teaching medicine as it is at our medical schools. And of course, we have to do this in collaboration with also educating our overall population. But and I want to start there and then to direct the real discussion coming out of the slides that were presented, one of the major impacts in terms of improving customer care, from my perspective as a physician in infectious disease, we interact directly and a lot with patients, is it also provides the opportunity for something that physicians wouldn't have before. We're having almost like a pre-patient analysis. So these systems can using that type of multimodal strategy, interface with previous lab tests, previous results, previous infections the patient would have had, etc. So you have all of that information actually before you actually see the patient. That can be almost like a pre-analysis before seeing the patient.
So,
And of
Dr.
course,
Ford, I want to stop you and I want to elaborate. I heard Dr. Jan speak about when the stethoscope came in. And of course, now we're way past that. So I want to ask you, related to what you just said, Pauline Fullerton, she wants to know, with the early predictions, are there early preventative treatments you use so you can see everything now are there preventative treatments that can be developed or can be used?
Well, I think AI. When you look at AI, I think you have to look at it from two platforms. The systems will perform according to the information that you give them, and they get better over time, over analyzing data that comes in, and a flood of data, which we as human beings probably can't do that well. I think yes. The answer to that certainly is yes. There are systems already in place that give predictive values. In fact, there's some systems I know, even in the UK, kind of look at your eyes and kind of say, hey, these are the predictions that you may develop disease X or disease Y, etc. That's where
We're
we're
going to get cataract in 10 years' time.
It potentially. So it allows you to then tailor behavioral activities in the patients to try to stop that. You may have genes potentially for something, but you don't necessarily have to have those genes going to play to cause an effect in the actual patient. And I think overall, the way how I see AI, and I know there's a lot of concern with doctors and nurses and impacting their jobs, etc. But I think AI, AI has to function in the context of a human being. And I'll give you a quick example, and then I'll stop talking. And one quick example, for example, I saw an X-ray exhibited just now. Just think if you ever went to a doctor, it's very simple, and they do a chest X-ray on you. An AI system can evaluate that. So there are some systems overseas which use humans as interplay. So yes, you do the X-ray. They have various things they're looking for. If all of them are normal, it comes out, hey, plum is normal. If there's abnormality, sometimes they ask the human being to look at it to see what's going on, even though it may have given its projections. But I think overall, cutting down waiting times, for example, redistribution of patients. For example, there's some systems that I very well know that actually you do a scan or imaging, and they can identify which patients are more important in that profile, and they go on the top of the list to be seen by the physicians in the stream of things. And lastly, I think it gives the physician, it takes away a little bit of the stress from the physician in terms of what I refer to as pajama time. So physicians spend a lot of their time after a long day's work writing notes or doing those things in our setting in the Caribbean. A lot of that can be lost with AI because they can actually compilate that information that you're having with the patient, compile that information. So you don't have to spend a lot of time doing that. You have a more patient-centered approach. You spend more time talking to the patient and getting information and bringing that level of care to the patient. So yes, it has its values, but of course there's some
also
challenges.
has some challenges. Thank you so much, Dr. Ford. Dr. Navi, I'm coming at you with a two-part question. So my first question is, will AI replace doctors and healthcare workers? Is that like for the future? Medical robots. I saw Dr. Jan gave us a clip of some robots in the operating room.
Shirley, is that a fair question to ask me? This hour of the day, after Dr. Janice did a great presentation, that's the controversial question. I get the controversial question.
That's the controversial. And I have a part B.
Yeah. Oh, okay. Well, good afternoon to everyone. Thank you very much to Jackson, the team, Dr. Jaja, everyone. Dr. Janice, Dr. Ford. Great meeting you all. I think I've interacted with Dr. Ford before, maybe on LinkedIn or so. But I'm so happy to have the opportunity here to discuss that question that you've just asked, which was asked of me 2 weeks ago in another panel discussion at the Hyatt in Port of Spain. And that was a mess. That turned out to be very, very difficult because people were not happy with the answer. It was actually a conference hosted by the Human Resource Management Association. So these are HR persons, right? It was probably not the best audience to talk about what could happen to their employees, especially in the healthcare space. But to answer it, I think that AI should be a tool, and it should support the healthcare management by doctors, because at the end of it all, we want better patient outcomes. And I think that's where the role of AI is. I will not go down into that rabbit hole to talk about which part of the medical profession it's going to replace, whether it's a nurse, whether it's a doctor, because at the end of the day, humans want that empathy. Humans want that personal touch. And personally, if I were a patient, I would not want to just sit down there and talk to a robot about my medical issues and so forth. I guess that time will come, but I don't think we are ready for that in the Caribbean. I honestly don't think so.
Thank you.
Patients want to go into the doctor's office,
Very true.
get an injection, and have a stethoscope on their chest. That's how we have always done it.
Especially when we get older, the doctor's visit is actually a real visit. You're going to look for your friend and you want to have a discussion. Very
Absolutely.
true.
90% of the medical visit is about talking out issues that may not even be related to the complaint. It's talking about their family, the stress that they have, it's mental health, counseling. It's so many other elements that I don't believe current AI systems would be able to emulate.
So you see AI as more of an assistance. So the second part of my question is, what partnerships or collaboration between the public and private sectors would be necessary to make digital health tools more accessible and beneficial for Jamaica, for the public?
And this is directed to?
You. This was second part of my question.
Okay. Well, as a physician who practices in Trinidad and Tobago, but we also, Patient Connect, we do work throughout the Caribbean. We're setting up something in Barbados right now. We will be collaborating with Jamaica, of course, through various partnerships. But what I would say is that digital health, just like AI, it's the same answer. Digital health is there to support. It's there as a tool. It's there to make the healthcare professionals, our lives much better, to give nurses more time, doctors more time, because the burnout is ridiculous, especially post-COVID. And if there are any mental health counselors here, what has happened to healthcare professionals and the burnout. And we definitely need those digital health tools. And there have been many collaborations, many partnerships in the making with respect to this. But of course, it has to be done with one thing in mind. And I think, Dr. Ford, you hit the nail on the head when you said that I find the prerequisite to providing digital health tools like telehealth, telemedicine, remote patient monitoring, introducing AI, it must be digital health literacy for our population. We can't do anything without digital health literacy. We have to go to the NGOs, we have to use the government, we have to use social media and educate, inform people. What was this telehealth thing? What is this telemedicine thing? What is this AI? And allay fears, anxieties. And I think only when we do that, then we would be able to say safely, yes, we can actually introduce these things.
Thank you. Thank you, Dr. Navi. Dr. Jan, I'm coming at you. So Dr. Navi mentioned a while ago education, and it's very important that we make the public aware of the benefits of digital health and AI. So what do you see as the biggest challenges to implementing AI in Jamaica healthcare system today?
Thank you for that question, Shirley. I believe the biggest challenges would be multifocal. There will be limited infrastructure, especially just the internet connectivity in certain rural areas. And of course, there are high costs in implementing AI technologies. Additionally, that digital literacy, that learning curve, will have to pay for a lot of training and time. And it takes time for just to get that savvy. And all our healthcare providers and patients would have to be able to adopt these AI tools effectively. So that training and education really is pivotal. And lastly, I would say that is the data security, really maintaining patient privacy with AI systems,
Yeah.
really essential in gaining trust and compliance, at least, with our healthcare regulations, but also for the patient to really feel like it's safe to send my data, to send my pictures, to send this across to you. I think
Yeah.
those are some of the challenges that we would have to really work through.
Thank you. Thank you for that. Dr. Ford, just continuing the discussion. What are the potential concerns around privacy and data security when integrating AI and digital health tools in the workplace? And how can you believe they can be addressed?
I tell you something. I think AI, for me, like I said before, and was reiterated just now, education is everything, and not only education of patients, but education of doctors. Like, that's going to be absolutely crucial. If that is not in place, everything else will fall apart regionally. Some other countries may be able to settle. I can tell you, in answering your question, is that if you look at UK and look at some studies in introduction of AI and how potential introduction, like almost like 50% of the respondents were clear in saying like they're not really comfortable with having a robotic system telling them, what they should do about their health, and they really wanted a more impact and that more personalized care along with that process if it was possible. And they thought like almost 75% thought we were going too fast with the process. So in itself, that's interesting. But I said before, the important thing, and I think regionally, and it's something we need to build on and make sure that we have proper cybersecurity for these systems. We've seen hospitals all over the globe being hacked, basically, and bring back systems back into the rudimentary style of healthcare, is paper-based in some cases. So I think people are concerned about those aspects, about where the information could end up if we don't have secure information systems within our hospitals. And many of the regional hospitals are having now are now introducing, at this late stage, of course, patient information systems, but that must come along with that cybersecurity in place. I think the other concerns, of course, regionally, because it's okay to say AI. I mean, okay to say collect information and analyzing and using multimodal strategy of all the different levels of patient information. But I think the other part, which I think is important, is that regionally, and I think at regional level, maybe national, but regional levels, there needs to be a quality assurance type process about how data is managed. If we don't look at how we're going to manage people's information, then we're going to get into trouble. And that's at the level of the legislative level. So that needs to actually come down from a much higher level than all of us on this call. Like how do we secure people's information? How do we release people's information? And who sees other people's information with all of the integration into AI into the process? So I think for me, that's important. And then lastly, any system that you introduce needs to be both reliable and efficient. And I know we always think that AI, I saw somebody in the chat room ask that question just now. We also think AI may always be 100%, and it's not. It's basically maybe not. And there are times where we may need to look over what is given, and the AI system in itself needs to be able to say, if it made a decision and say this is X, there needs to be explainability in terms of how they arrived at that conclusion. And that's where humans come in. We need to figure out if it's totally
This is actually the right conclusion, the doubt, the lack of trust.
Yeah. And I said that, and I'm finished now, and I said that because, again, with if there's a lack of cybersecurity and information is mixed up, you get a totally different answer, which can impact patient care. You got to be really careful. So I think key cybersecurity, education, as we said a million times here over, and the legislative wing needs to be in place before countries across the region go, straight into it, and then we get into trouble because we didn't anticipate the challenges, legal challenges that might come later. Thank you.
Thank you for that. That was certainly very informative. Dr. Nabi, I'm moving it now from the healthcare, whether public or private, and I'm bringing it to organizations. What role do you think AI can play in mental health support? So often, workers, staff, we're so burnt out. And how do you think employers can implement tools to reduce stress and burnout?
Yeah, Shirley, that's an excellent question too, because since 2018, Patient Connect, we have been working with companies for their employee wellness programs, corporate wellness programs. And mental health was, let's say, maybe 50% of the problem at that time. But after COVID, it's almost 90% of the problem. And one of the things that we have done traditionally in the Caribbean is that we have adopted these EAP, employee assistance programs. And they have been in person, they have worked. But in this digital age, we really have to pivot. And where do we pivot to? Everyone has a smartphone. And many mental health counselors are now doing consultations online. It may not be the same experience. Again, we talk about the personal touch and being in the same space, the same room, but it has worked very effectively. I'll give you a little survey. So when we had over 10,000 users during COVID, 10,000 people who accessed a free healthcare platform called Virtual Wellness. And it was available to people in the Caribbean. A lot of people in the diaspora used it. And out of that, over 10,000 users, 80% of persons just didn't know what to do, where to turn to because of the uncertainties of the pandemic and whether they would have a job. People lost their jobs, their health plans. They weren't too sure what's going to happen to them. So you're absolutely right that mental health is something that we need to continue to address in the Caribbean, not just Jamaica only, because we have implemented it, Patient Connect. We have in partnership with HERMAC, the Human Resource Management Association. They're responsible for the HR people. You all have HERMAG in Jamaica, HERMAB in Barbados, right? And what they have done is that we have partnered with them and we have offered them certain digital health tools to really offer to their employees so that they can get a lot of access to mental health services, in addition to other services, doctors, dentists, pharmacists, nutritionists, these type of things. But one of the key things is that they have gotten access to mental health, and the feedback has been tremendous. The uptake of it has been really, really good, because one of the challenges, again, coming back to the EAP, is that people feel they have to go through the HR person, and the HR person might know my business. I have a consultation with a psychologist, the company's paying for it, yes, but they always feel like this information is going to go back to the employer, and the employer is going to victimize them at some point in time, because we still have this stigma in the Caribbean. You're crazy. If you're going for mental health counseling, something wrong with you. And we really have to change that stigma. We really have to change that mindset. So using our digital health platform, using your phone to chat with the mental health counselors at any point in time throughout the day, 24/7 services. It's not going through the HR necessarily. They were able to access these services, and they were actually, they saw the improvement. The HR and the employers saw the improvement in their employees.
Thank you for that. And that's so important now, as you said, burnout is real. It is a real, mental health is real in the Caribbean today. So, it is very needed, these programs within workplace.
Just before you move on, I want to just make a plug here. We have all of our islands, we have a major crime problem. It's a crime epidemic. But look at what is causing it. It's mental health issues.
Yes.
And that should be the focus in the Caribbean. Yes, I'm all, Dr. Ford, Dr. Janice, I'm all for spending lots of money behind chronic disease. I am all for that. We have a major problem too with diabetes and high blood pressure, heart disease. But we need to really get serious and focus on mental health, because that is fueling the crime problem. That is fueling a lot of other issues.
I am certainly not trained as all of you on are, but I'm also seeing that it tends, what we are seeing in society, it really affects men. And because they don't speak up and they don't, can't get counseling, etc., it really plays out. So if these programs could be implemented and they could do it privately, I think it certainly would help all our societies. I totally agree. Dr. Jan, I'm coming at you. How do you see telemedicine and teleconsultation evolving in Jamaica and certainly the rest of the Caribbean? And what benefits can employees gain from the access to virtual healthcare?
Thank you for that question. Telemedicine, I think, has been around for quite some time, but COVID sort of accelerated its use. And I do think it will offer efficiency, it will offer reduced costs in certain situations. There are a number of practitioners who charge less for virtual compared to in office because the experience can be different and the utilization of staff and resources can be different. But I also see it as a way of access to care in a very timely manner. It can be very life-saving, because there are many times when you would not be able, for one reason or the other, to get a vehicle and get to a healthcare practitioner. But there are these platforms that you can go and log in within a few minutes and speak with a doctor and find out if this is something that is a red flag or if this is something that we can observe. So I think it will improve efficiency, access, it will reduce costs, and I think it will be definitely more cost effective for a lot of employers as they can, create these sort of alliances, strategic alliances to have their employees, especially in industries where there may be, injuries or hazards, have access to care in a very timely manner, and it may work out to affect the bottom line really positively. So virtual medicine is here to stay, and it allows us to access specialized care around the world, to network, and to bring in others into the consultation who may be in another country, in another time zone, but we can have them sit in, listen to our patients. And so for all concerned, the patients, the doctors, the employers, all of our payers, I think this would be an important area to really facilitate its growth.
I agree. And you mentioned about the remote locations. Certainly, we live in the Caribbean and a lot of persons live in remote locations. They may not be able to have access to public transport, but everybody has internet nowadays. So certainly they have access to these healthcare, digital healthcare. And I'm just going to ask Dr. Ford, we're just going to segue into how can these healthcare platforms, because Dr. Navi alluded to it, yes, mental health, but we are a Caribbean that suffers from certain chronic diseases, diabetes, high blood pressure. So how can these healthcare platforms, these digital healthcare platforms, help persons manage these chronic conditions and while maintaining productivity at work? So just to segue into what Dr. Jan just spoke about, but to elaborate a little bit more as it relates to the chronic diseases that affect the Caribbean people today.
Yeah. Obviously, the Caribbean is riddled with many patients with many chronic diseases, and as well as it goes as far as to say as families. So diabetes, hypertension, and then first and second generation family platforms as well. People who would not have hypertension or diabetes yet. I think these type of platforms can use and analyze information to try to do early risk stratification in clients. So mind it not that you may not have diabetes yet, or you may not have hypertension or or even some of the other more technical diseases. What it can help do is kind of to look at all the different platforms. And probably Dr. Janice is probably even more qualified in this than me based on what you said. But it can use all of this in terms of genetics, all of these different aspects to come together to try to risk stratify the patient and put them into a category. It's then left up to the doctor to decide how that is done. But I think one of the aspects of AI, and I be honest with you, I am not really au fait with this particular part, but in logically thinking, if people are at higher risk for diabetes, hypertension, severe hypercholesterolemia leading to cardiac disease, etc., I might imagine that the AI system may be able to do much better than a dietitian in advising them. These are logically, these are the sort of things you probably need to stay away from and kind of advise some more healthy diet. So that might be a nice way of looking at that platform. The whole idea of coming out of chronic disease, and I know there's been something recently on this in terms of neuroscience, is even trying to risk stratify people who are at risk of one of the most feared mental diseases that we don't talk about because nobody wants to talk about it, but we're all getting old, and we all get memory issues and forgetfulness, and some people get Alzheimer's for different reasons over time, and progression. So I think even maybe able to identify people who may be at risk of that, putting a whole set of factors together, that type of multimodal approach. And I think one thing in the Caribbean that I would say, unlike some of the other parts in the world at this particular point is, and I could say for sure for Barbados, my predictions are that we're going to have a very aging population. In fact, that's a big challenge for us. And with an aging population, you're going to have to try to manage all of these aspects, and I'm sure AI will play an important part. And the last point, which I think is to me quite important. When we think about diabetes, hypertension, mental health, and all of these different aspects, they all can play in to the AI approach. But I think, especially in mental health, a good old person who the person can communicate with on a human level is still going to me, be top brass, whether it be by telemedicine or that one-on-one approach. I think that mental health component is important. I just want to stick a pin to say that I think one of the things that the entire world, I said, I'll be honest with you, I said this when COVID broke. One of the things that I said in country and globally was the impact of COVID-19 on the human population we're going to miss. And I remember people was like query or something else, and I said the mental health component post-COVID is going to be more dramatic than COVID itself. And I believe that we're living at this point and seeing the outcome. Yeah, hidden components. Can AI help with that? Well, maybe. But the old good human, as Dr. Navi had said, the good old human touch. There's nothing like the good old human touch in terms of medical health care. Thanks.
Well, I was going to ask a bolder COVID question next. So since you have led the conversation there, anyone can take this question. It is from Michelle Lewin in the audience. And her question is, why was COVID not treated using recommendation by our local medications rather than vaccines from the West, which caused lots of lives? And why wasn't AI more involved in the entire treatment of COVID? You went there, Dr. Ford. I've had this question up, and you said
I'm the infectious disease doctor. But I think it's a little bit more than infectious disease. What I would say is I don't like controversial questions, but as a physician, you have to address things. So I'm going to address this by saying I totally agree with the vaccines and the cause of a lot of deaths. That I'm going to start off by saying that. I'm not going to get into that controversy on this particular call. But I'm not really sure how the AI could have changed the course of what we had. What I would tell you is the last pandemic for the human race was almost 100 years ago. AI generally uses technology and information from before to try to generate information and positions and things. So I don't even know that the AI systems would have been good enough to even change the course of things in terms of COVID-19. And that's my strong take on that particular position. So I don't know that, and the question there also speaks about local medication, etc. I'm not quite
Medication.
sure I have no idea what they're talking about. But one of the things that I certainly have recognized over time is that some of the medications that people would have said might would be helpful and stuff in the early parts of COVID probably would have worked, but we didn't know. And this is just medicine as we see it. We learn, and the same as the machines learn, and they draw conclusions and things. We are to learn in the medical field so that if there are issues with pandemics or stuff in the future, that we will better manage them. But I'm not sure that AI could have really made any definitive impact. And the reason I'm also saying that is because it's not only Caribbean involved. I mean, the whole globe was involved with people with these technologies already in place. And I think if we saw the world crumbling under COVID and those measures weren't used, then I don't know that there would have been any greater impact. So
Dr.
another
Navi,
one, I don't know.
Dr. Jan, you want to weigh in?
Dr. John?
I think COVID, at least here in Jamaica, was treated in several ways. Everyone that, I mean, I'm an integrative physician, that I had in my circle was being optimized with nutrients, zinc, vitamin D, C. We were using plant extracts, we were using medications. The purpose of the vaccines wasn't some about, but really trying to spread by creating this herd immunity. But I think volume AI powered telemed to give access to healthcare for all our patients. We were communicating more, we had helplines, and a number of AI systems throughout the Caribbean to track and predict disease outbreaks. Just analyzing little patterns and putting raw data from where the patients that were diagnosed were coming. So it was in the background, both in telemedicine, also epidemiology and tracking. I think COVID was so frightening, it inundated many health systems. A lot of people couldn't access care. So we had to use a number of traditional therapies. So it was not that it wasn't utilized, it was utilized to the best that we had. And we have to learn from that to build strong teams, better with our predictive analytics and faster disseminate information. But it thrust upon us this whole digitization of medicine, and I think we responded the best we could, and it really saw greater collaboration, greater efficiency in operations, and just an outpouring of just time and assistance from physicians who were retired, created a lot of mental health and burnout, and that's because it really saw a number of systems and areas being really taxed. But I think AI was incorporated, especially in tracking, especially in telemedicine. And I think all forms of medicine for supportive care were offered. So from my perspective, yeah, we did all of it. It's sometimes not what was really reported, but it was all happening.
All happening in the background. Dr. Navi, any last word on that question?
Yeah. I think, let me agree with my colleagues that, COVID came like a thief in the night. We had to do what we could have done as a Caribbean people to respond. Every healthcare system would have been maybe at a different place, but ultimately we had to use evidence-based medicine. And we also, there were others who tried to look for other solutions. And I support that. We try to look for other things. I'm a big believer, just like Dr. Janice too, that we need to always, use, vitamins, minerals, our supplements, these kind of things. I think that we did what we could have done. AI is now going to be used, as you also mentioned, in predictive analytics. So, for example, if something is on the horizon, another pandemic is coming, we can probably use now AI to really, use that to see what the data is, what are the hospitals reporting, what are the health centers reporting, and that could improve how we respond to that next pandemic.
All right. Oh, thank you. Thank you for that very lively discussion. And thank you, Michelle. I know you thought I forgot your question, but the question, I knew it was going to be some, really interesting answers. So I left her question for last. Dr. Jaja has made a comment to say that with digital healthcare and teleconsultation, usually some companies have no copays. So it actually is the better way to go for the client, for the patient, to do digital healthcare and teleconsultation. Are you finding that in the areas, in the regions that you operate in? Or you're not sure? You don't know the administrative side, so you don't know if there's a copay or not. When you use your card, sometimes the patient has to copay. What we're seeing is that with digital healthcare and teleconsultation, there's no copay with some insurance companies. Are we seeing more and more of that?
Yeah, it's an interesting point because the two major insurance companies in Trinidad reported a very low adoption of telehealth usage during the pandemic. One of the reasons would have been the ability to pay and to make a claim. There wasn't a very simple system for the doctors or the patients to be able to do that. We didn't have those online payment systems at the time, the easy patient portals with the insurance companies and so forth. So that was one of the challenges. Now, I can't say that has been fixed by the insurance companies in Trinidad, at least. I think the insurance sector on a whole has a lot more work to do to get to e-insurance. We really need that e-insurance ability for easy claims and easy processing. It's still quite cumbersome and complicated. So that actually is a negative towards people using telemedicine and as a way of virtual consultations.
In Trinidad?
In Trinidad, at least.
But Dr. Jan, one second, Dr. Navi. Dr. Jan just gave another spin on it. You want to add to that in Jamaica, Dr. Jan?
No. We had quite a bit of telehealth, and yes, it was initially that you could not swipe your card and claim. You had to pay upfront for these and claim back. There were some provisions being discussed with the MAJ, the Medical Association of Jamaica. I can't quite remember what was the final.
I thought the comment was from you, but it's from Gino. She says you can actually get a health claim form with one of the theme companies here in Jamaica.
Got you.
Yes. All right. I think we've had a lovely discussion. It's really been very enlightening. So I'm going to open up the floor now to each of you for any last comments on the topic. Please. Just jump right in and go ahead and we close it out.
I'll go first and leave the others for the end. I think if we're going to really impact the Caribbean in terms of medicine, in terms of AI, our first strategy has to be, we have to really look even at our medical schools, medical training, and to start from there. It needs to be part of the programs from now, because that's where we're going. We all on this call know that's where we're going, so we can't pretend. One, and then the last point from my end is we also need to start from now education our public about AI, its impact, and probably where we need to go. And then finally, the legislative branch of this for patient information security is going to be important, and that needs to be looked at as well before any country really embarks on a large-scale AI program. Thanks.
Thank you so much, Dr. Ford. Dr. Navi?
Yeah, totally agree with Dr. Ford's summary. I think one of the things to probably move Caribbean governments would be the economic impact of the whole transformation of healthcare using these digital tools. We are currently conducting a survey and looking at some of the research. Recently, the budget in Trinidad and Tobago was read, and we spent something like 7 billion TT dollars in healthcare. And a large chunk of it would be administrative services. And you know what that would be? Outside of paying salaries, it's paperwork, right? It's stationery. And I think Dr. Janice, in her presentation earlier, she mentioned about the administrative burden that could be relieved using AI and digital health tools. And think about it for a moment. If our hospitals and health clinics went paperless, just for a moment, how much money we would save just by doing that. Start very, very simple. So I think in order to engage the governments of the region, we have to, we all talk about it, the budgets, the healthcare budgets are being stretched because of the chronic disease epidemic. And what about if we were to really do a serious look at how much we spend on things like stationery, how much money we could save on just implementing basic digital health technologies, electronic health records, patient portals, remote patient monitoring, AI scribes. I know we didn't get to talk much about some of the nitty-gritty stuff, but I'm a big believer in these new AI medical scribes. In my practice the last 2 years, I don't write anything and I don't type anything. I chat with my patient, the computer listens to everything, creates the note, I just save it, and I put it into electronic health records for the next visit. Yes, you have to review it sometimes to make sure that the AI is accurate. And there are many systems now being used. One, we have been trying to develop it in the Caribbean to make it a very native software. But a simple thing like having a paperless consultation, and patients love it because you can actually look the patients in the eye and have a full conversation. They're writing. How many times you go to a health center and the doctor has not even looked at you, right? I mean,
I have to ask you though. Will the AI understand the various Caribbean accents and write the correct thing? I'm going to ask you that.
Believe it or not, I sometimes think it's some kind of black magic because the patients coming in, they're talking about CPL, they're talking about all kinds of things, they're talking total Trini, and it doesn't record those things. What it would sift out what's the important thing, what's the complaint, what the symptoms, what you did on the examination, those kind of things. But just that alone, implemented in public healthcare spaces, could reduce our budgets significantly in conjunction with electronic health records.
And hopefully the cost to the patient. Hopefully we'll start seeing less costs, healthcare becoming cheaper, more affordable.
And let's redirect that money to mental health services, chronic disease services. And then we can say that digital health and AI is actually helping us. Absolutely.
Thank you, Dr. Navi. Dr. Jan, the closeout is yours. You started and you ended. Go ahead.
Thank you, Jay. I think I want to say that
Dr. Jan, we're not hearing you.
Okay, right, internet issue.
Yeah, we seem to have lost Dr. Jan. Let's give her a little time, see if she will pop back on. She's back. Dr. Jan, you weren't hearing. Yes, you are.
I'm sorry about that. Thank you. No problem. So I wanted to just kind of wrap up by looking at the ethical use of AI in healthcare. This area is inevitable, and I think we just have to plan for it. It's coming. And so it really involves establishing clear guidelines, data protection policies that govern the use, particularly with regards to patient privacy. It's important to promote transparency in how AI systems are developed and used and how data is shared, and to ensure that the AI is applied in ways that promote fairness and equality in access to healthcare. But just these continuous monitoring and auditing of the AI systems will ensure that they operate within ethical boundaries and benefit the whole region. So I think, we didn't talk a lot about ethics, but is all of the conversation around privacy and around sharing of data does involve the ethics, and it is being done. And I think we have to slowly make steps towards that as we work to have this patient-centered approach that's high standard, low user error, and really able to benefit the whole system, which will be a win-win for patients, physicians, regulators, and payers. And that's what I would like to close with. Thank you.
Thank you so much. Thank you, Dr. Ford, Dr. Navi, Dr. Janice. This discussion, as I started with, was the most exciting for the day, the way to go after lunch. And Althea, I'm going to hand back over to you.
Let me tell you, this was an absolutely amazing conversation. So many takeaways that I don't even know where to go, but it is really interesting to learn the various ways that AI is already assisting in healthcare, machine learning, vision, natural language processing, robotics, and of course, the importance of this paradigm shift that is taking place that can lead to improved diagnosis and treatment, enhanced patient engagement, operational efficiency. But of course, recognizing that artificial intelligence is really something that is coming from human beings, created by human beings. And so those ethical conversations and considerations need to be had in terms of how it is that AI is used in healthcare. But I must tell you, absolutely fantastic panel discussions. Thank you so very much, Shirley, for the masterful way in which you guided the conversation. And all of your panelists were absolutely amazing. And I'm very happy that this is a Caribbean-wide kind of conversation that we had, where the ideas, you're bouncing ideas off of each other, and you're all on the same page. So we understand what is going on here. Thank you so very much again for this fantastic conversation. I think we can use this as a benchmark in terms of how it is we move forward with the use of artificial intelligence. Thank you all so very much for sharing your wealth of experience with us, Dr. Miss Shirley Bridgman. I'm speaking that into being, so maybe sometime I'll call you Dr. Shirley Bridgman, Chief Executive Officer and Executive Director, Caribbean Assurance Brokers, Dr. Navi Muradali, CEO of Patient Connect, Dr. Janice Simmons Fisher, Clinical Director, Bioregeneration Integrated Medical Center, and Dr. the Most Honorable Corey Ford, Executive Director of Clinical and Diagnostic Stewardship Consultant, Internal Medicine and Infectious Disease out of Barbados. Thank you all so very much. And I really want to say a big thank you to our sponsors as well, the Public Sector Modernization Division, PSMD, the Ministry of Finance and Public Service, the RGR Gleaner Communications Group, their platinum sponsors, both of those organizations. We have partnerships with Jamaica Cultural Development Commission, JCDC, the Private Sector Organization of Jamaica, Rhythm FM, and the Caribbean Center for Organization Development Excellence Limited, CARICODE. In the gold category, National Commercial Bank Jamaica Limited and Bank of Nova Scotia Jamaica Limited. In the silver category, Jamaica Public Service Company, VM Group, and the National Housing Trust. And in the bronze category, JMMB Group, National Health Fund, Guardian Life Jamaica, Jamaica National Group, Burks Auto Parts Limited, the Tourism Enhancement Fund, Restaurants Associates Limited, the Bone and Joint Center, JN Fund Managers, and we say a big thank you as well to Mr. Terrence Lawrence. Of course, we don't want any of you leaving here feeling as if we didn't give away enough stuff. And so I'm going to ask Danny to bring up that wheel for us, because we have a wonderful gift of a 1-hour coaching session coming from Dr. Nsombe Jaja. And Dr. Jaja, if you're still there, I just want you to come on and explain to us exactly what people will get. I'll give you about 30 seconds to do that. But let us just spin the wheel first and see who's going to win this 1 hour coaching session with Dr. Nsombe Jaja. Keisha Powell. Keisha Powell is the lucky winner. She is the winner of this 1 hour coaching session from Dr. Nsombe Jaja. Girl, you're in for a fantastic ride. I know this is going to be great. If we have Dr. Jaja on, then perhaps we can bring her in and have her explain exactly what this coaching session is all about. Let us see if we can do that. But while we're waiting for Dr. Jaja to come on, let me do some other giveaways. We're just waiting for Danny and the team to bring Dr. Jaja in so that we can get that, because this is all very good. I tell you, one of the most fantastic things about this is that we learn so much from these sessions. Dr. Jaja, what a generous woman you are. We know that an hour of your time is very valuable.
Yes, enough money. But let me tell you, there is a saying, to give is to have. And I have found that my coaching sessions have really just helped people to press the reset button and really go on another path. Yeah, that is so transformative. And I just thought that I would give away a session because, sometimes just a little word I share with somebody can change the direction of their lives. And so as a certified coach, yes, a certified Dream Builders coach and a certified John Maxwell speaker, coach, and trainer, I thought that I would give this as a gift to someone. And Keisha, congratulations, girl. I hope you take it up, All you need to do is to send me an email at nsombejaja@gmail.com telling me that you won this on the JAXA conference. And you're on. All right? Blessings and love.
I see how excited you were over the presentation that just went by.
Yeah, tell you, Chica. Boy, conference coming up this year.
You get so excited about medicine.
Absolutely wonderful. This year, man.
Yes, so good. Thank you so very much once again, Dr. Jaja, for the inspirational leadership you offer as well. All right, so we're waiting to get our presentation going, but I still have 2 giveaways. I have 2. In fact, I have 3. Maybe I'll save one for the end. But I'm going to do the cards that we have. We have 2 more cards left, one from Flow and one from Digicel. Are you ready? I'm ready. Let us start with Digicel. 858-850-922-8375. And please drop in the chat if you have won, because if nobody wins it, then we're going to have to do that number all over again. Let us move to Flow. And by the way, we didn't point out that this is $200 credit that we're giving away, okay? Ready now for Flow. 432-396. 496. 85012. All right, so that's the Flow number. Please let us know if you have won so that we can acknowledge that you have actually won. All right, so ladies and gentlemen, we're winding down. I think we've done very well with time today. Yes, it has been absolutely fantastic. I think we have Avery Crooks Campbell back with us, yes. And Avery is music development specialist with the Cultural Development Commission, JCDC, and the Customer Service Song Poetry Competition. She has been responsible for that over the years, and she has been doing an amazing job. And clearly a performer herself, as you'd have heard her earlier this morning. And so she's the competition coordinator with JAXA. And we're going to invite her to join us in just a bit, but I understand that we do have a presentation focused on the sponsors. Do we go to that first? While we wait for Danny to tell me if we're going to take that first, let us congratulate Tracy Lewis. And Tracy Lewis won the Flow credit, so congratulations to you, Tracy. And as we said, we're an equal opportunity organization, JAXA, and so we're giving away both Flow and Digital credit. And don't think that we're done yet. We'll be back tomorrow with more to give away. That is what we're giving away today. We'll be back with more come tomorrow. So Danny, tell us, are we ready with that sponsorship slide? All right, fine. So we can let me just use the opportunity then to just say a big thank you to our sponsors. Public Sector Modernization Division, PSMD, Ministry of Finance and the Public Service, RJ Arglina Communications Group. We have National Commercial Bank Jamaica Limited, Bank of Nova Scotia Jamaica Limited, Jamaica Public Service Company Limited, JPSCO, VM Group, National Housing Trust, JMMB, National Health Fund, Guardian Life Jamaica, Jamaica National Group, Burks Auto Parts Limited, the Tourism Enhancement Fund, Restaurant Associates Limited, the Bone and Joint Center, JN Fund Managers. We also have partnerships going with the Jamaica Cultural Development Commission, JCDC, the Private Sector Organization of Jamaica, PSOJ, Rhythm FM, and the Caribbean Center for Organization Development Excellence Limited. We've had an absolutely fantastic time so far, and I know that more is in store for us. Ladies and gentlemen, welcome back to the stage, Avery Crooks Campbell, Music Development Specialist of the Jamaica Cultural Development Commission, JCDC. Avery, over to you.
Thank you so very much, Althea. Hello again, everyone. The afternoon session is just as sweet and juicy as the morning, and we're looking forward to tomorrow. It is my privilege to introduce to you our next presenter. He is none other than Dr. Ija Thompson. Dr. Thompson is a proactive promoter of embracing a healthy lifestyle as a way of life. He is the CEO of Essential Medical Services. He has been delivering clinical excellence in general practice for over 20 years and positive results in organizational development and team facilitation for 10 years. His postgraduate and executive education focuses on themes such as resilience, work stress, leadership, workplace wellness, behavioral policy, appreciative inquiry, and coaching. He leads fellow medical wellness and organizational professionals within his Thrive at Work team to develop and implement comprehensive standards-based workplace wellness solutions for a diverse range of organizations. He's an advocate of having a balanced and rounded Christian life. His hobbies include reading, gardening, and jogging. He is married and a proud father of 3 children. He passionately strives to become a better humanitarian. Ladies and gentlemen, Dr. Ija Thompson.
Hi, good afternoon, everyone. I'm hoping that you guys can hear me nice and clear, and I'm just going to ask anyone that can help me to know that my audio is good to just give me a little cue. All right, awesome. Thank you so much, Danny. All right, everyone. So I've been tasked to spend the next hour with you to really look at ways in which we can move service excellent to beyond excellence. So you might say, well, what is beyond excellent? Well, I guess we're going to define that together. So we want to put workplace wellness to work in our workplace. We want to take Jamaica above and beyond as the theme for the conference is set. And I do hope that for each of you who can type in the chat that you will stay with me and let's put wellness to work together right here, right now. How about sharing the chat very quickly just to see if we're all together? You know, what do you appreciate most today? What do you appreciate most today? Drop it in the chat as quickly as you can. Let me see if we are connected and we're moving together. Awesome. All right. I see that I'm still, all right. Awesome. I see them coming along here. All right. Awesome. I was in the wrong window. My life. All right. Waking up. Life and wellness, the gift of life. You know, an interesting thing about gratitude is that gratitude actually helps to make us happier, wealthier, and wiser. How many of us knew that? And it simply takes just asking yourself this question. Whether you ask it daily, you ask it more than once a day, what do I appreciate most today? That's wellness being put to work there for you. Another big thing for us when it comes to service excellence or just the workplace, full stop. Thanks so much, guys, for sharing. I'm happy everyone is connected. Another big way in which we can easily put wellness to work is to reduce the distractions through mindfulness. Mindfulness is probably one of the best exercises you'll do without lifting a finger on your hand. Mindfulness is about exercising the brain, but using attention to exercise the brain. And so I'm going to invite each of you right now to just do a little mindfulness exercise with me. And it's all about simply just changing the way you breathe. Now, you might say, how can changing the way I breathe help me to be less distracted? For those of you who are not familiar with mindfulness. But essentially, when we breathe, we are in the present because we can't breathe in the past and we can't breathe in the future. And so we are committing ourselves to be in the present as we breathe. And the same thing goes for all of our sensations, right? When we are connected to our sensations, we are committing ourselves to be in the present. But an interesting thing occurs as well. Because we are in the present, it allows us to be aware. It allows us to connect. It allows us to achieve what we intend to do and be less distracted. So let's put this one to the test and you let me know how you feel in the chat when we're finished. Let's just change the way we breathe for a little bit. And let's just for a moment sit back in our chairs if you're sitting and just breathe a little deeper. Breathe a little slower. A nice deep breath in. And we just hold it for a little bit. And then a nice extended breath out. You know, feel yourself just relax back in that chair. Let's do another one. A nice big breath in. And we hold it for a little bit. And then allow that nice long exhalation to allow you to sink back in the chair. How about another shift in our breathing? Let's shift to just focusing all our attention on our breath. So as you inhale, you may notice cool air entering your nostril. And as you exhale, you may notice warm air coming out. Let's do that a couple more times. Inhale, your lung expands. Exhale, your lung relaxes. Inhale, your abdomen expands. And exhale, your abdomen contracts. All we did a while ago was to shift our attention to our breath. And I'm sure for some of you, you may be feeling quite relaxed right now. Probably some of you after lunch probably want to do a little bit more than just relax, probably even want to take a nap. But others of us, we may feel renewed. We might feel a sense of, yeah, I'm here now, right? And that's the beauty of being connected to the present. We are mentally here, and being mentally here, we can benefit from all the things that are here. For each of you who enjoyed that a while ago, I'm hoping I can stretch your mind a little bit as you start to get a little palpable feel of what wellness can do in just 3 minutes. Taking the time to extend and expand what you appreciate and to be able to become more attuned to what is happening right now are 2 simple exercises that, if done recurrently, without a muscle lifting, without spending 20 minutes on a treadmill, you're able to perform better. you're able to live happier lives, you're able to live better, you're able to have better relationships, you're able to perform better. Your excellence moves beyond. Now, we're always asked the questions as workplace wellness consultants or facilitators, does wellness really work? And I like to just, give a little try of just what some of the less common exercises are, and to help each of us to just feel it and say to ourselves, if we were a little bit more calmer, if we were a little bit more focused, less fearful, less anxious, do we think we'd perform better? And I'm sure if I ask you who are in the audience right now, do you think you'd perform better if you're a little bit more calmer, a little bit more focused, less distracted, less anxious, more composed? Would you perform better? Just put yes in the chat if you agree with me. Thank you, Insombe. So I think most of us, if we give it a try and try to live that side, we do, right? And if we can do this in just a few moments, a few minutes, and see an effect, whether being calmer or feeling a little bit more connected as we share what we appreciate, then imagine what we could do as a country or a region. Now, I'm going to ask for forgiveness from my Caribbean friends, right? I put Jamaica the best place to work simply because I'm in Jamaica right now, right? I realize that on the streaming engine that we're on, the flow of the slides don't necessarily go, and I'm not getting the breakouts of the respective segments, so you can see everything in one go. But fear not, we'll just continue just the same. But put whichever country you're from in the top sentence, the best place to work. I'm going to use Jamaica right now because I'm here, but if you're in Barbados, the best place to work. Trinidad, the best place to work. You name it. I'm going to declare my bias. All right. And hopefully you forgive me for my bias. But what would that be like if each of our countries were the best place to work in the world? We talk a lot about being developing nations and not being able to compete with the capital that other countries can generate to pay. And we have this brain drain occurring because everybody wants to go to a developed country. But can our country be the best place to work? And if you think your country can be the best place to work, just put your country in the chat for me, right? So whichever country you're from, just put it in the chat if you believe your country can be the best place to work. See a lot of Jamaicans coming through already. No, you have to really believe it, because if you really believe that your country can be the best place to work, then I'm going to cue you in on that word, to be the best. And what does it really mean to be the best? And for most of you, it may mean being better than others, right? And that's what we learned in school. We're compared to our colleagues or our fellow students or classmates in school, right? And even at work, we're compared to each other. But being the best goes beyond that, right? It's not just simply about being compared to some normal curve, standard curve, right? It's more so about being positively deviant. And that's the positive side of deviance now, not the negative side that we're so used to hearing on the news everywhere in the world, things going wrong. But positive deviance is about being exceptional. It's about being extraordinary. It's going beyond just excellence, right? You stand out from the crowd. And for Jamaicans, we like to talk about Usain Bolt and Bob Marley, who just stand out and apart from the world. We say we're little, but we taller, right? Here, and each of us in our own countries have our own statements, right? Thanks, Navi, for bigging up TNT there, right? TNT, the best place to work. Yeah, so I want you to first recognize that being the best is not simply about a comparison thing. It's recognizing that we are wired differently. And because we're wired differently, we do have to be compared on money and how much we can pay, but we can be compared on the things that we're strong at. And so we know in Jamaica, we just can't run fast. The have a lot of stories in Jamaica about why we run so fast, right? And of course, why we sing so good. But that's for another conversation. But the whole idea is that if we focus on what we're strong at and what we have as possible for us, then that can be our guiding light that energizes us, versus what is wrong with us or what we cannot do. In other words, what we can't compete in, and allow that to simply be our shadow. That shadow really just tells the direction that the light is coming from, and not so much the black hole that we can't escape, right? And I believe if we start to look at ourselves as a region, and each of us as nations, then we will see that if we really want to be the best place to work, then it would mean putting wellness to work at work. Because essentially, when you boil it down to what wellness is, it's simply about becoming our best self. Now, I'm sure there may be some scholars online, and you may talk about wellness in different regions, right? The more Oriental form of wellness and the more European form of wellness. But let me clarify that I'm talking about the more North American and our region. When we look at both Latin America, South America, the way in which we look at wellness is about development. How do we become better? How do we become our best, right? So there's a lot in wellness about aesthetics. There's a lot in wellness about how we're able to, feel good, right? And those things, yes, they are also different ways of looking at wellness. But wellness, when we speak about wellness at work, what we're speaking about is how can we become better and how can we become our best? How can we be positive to deviant? And if our country is going to be, our region is going to be the best place to work, then the question is we are going to have to ask ourselves is, what is work and what works well at work when we're at our best? What works well at work when we're at our best? So let's dive into that a little bit. And I can probably just pause a little bit, given that the platform I'm as a guest right now doesn't allow me to gently allow you to see everything in stages. So before I jump the slide, I'm going to ask you, what is work? Talk to me, guys. What is work? All right, I hear that. I see that. Light, shadows. Okay, great. Light and shadow creates the big picture. Thank you so much for that, Nsombe. That's really, really powerful, right? And sometimes we get caught in the shadows, right? And instead of using the light. So talk to me, guys. What is work? Let the secret out. What is work? Like that harmony, respect, appreciation. Work is worship. Wow, I love that. Lady Elsa. All right, so as you guys continue to ponder that, because I've had many a conversation about this, a lot of people believe work is simply about a paycheck and being able to take care of all the things I want in life. That is work, right? And I beg to say that, yes, while for a lot of us, that's how we see work and experience work. If we're going to really meet the charge of this conference of really transforming our country and our region into being exceptional, then we're going to have to take a little deeper look at what work is. And if we can do that, then I believe that wellness will be something that works. And in workplaces where wellness works, we're going to provide the fuel for human excellence. I want you to hold on to this perspective of what is work and why do we work? Because in my way that I want you to think about it, I want you to think about the purpose of work as being often found as using the pleasures of work. Sorry, let me repeat that. I want us to think about the purpose of work being often found in the pleasure of using our strengths, our gifts, and our valued resources in delivering the best service to others for a cause on our journey to becoming the best of ourselves. Work, in essence, is fuel to us. It is fueling us to be fulfilled by helping us to meet our intrinsic needs and our intrinsic ability to be able to achieve our best potential. Now, that might be a slightly different perspective to think about work, but I'm hoping it starts to give you ideas about what work can be for you and the people who work with you, as we try to help each other to now start to think about how can we have the best place to work. Because if we're going to have the best place to work, then we have to recognize these strengths, these gifts, these talents that people are bringing to the table. And if they're bringing it to the table to deliver their best service, then how can we then help them to become their best self in terms of what is great for them? Where wellness works at work, good becomes great and great becomes its greatest. I want us to, start to stretch our thoughts on what work is and how work really works when it works well. In the traditional sense, work is about being able to achieve the purpose of our organization by the task that we're given. But of course, we are more than just coming to a place to do a task, right? We're also committing to come together as a people to meet the needs of this place and time that we have been fortunate to exist in. And somehow between the purpose of whether the stakeholders or shareholders to make a profit, or the purpose of the NGO or the government agency to serve a purposeful social cause, and the means to do that effectively and efficiently must be met with this need to be able to help human beings to do that work. And a lot of times, the way in which work is approached is that we need efficient processes, we need efficient ways of getting to our purpose, but the people who need to do it is not optimized to do so. And so your approach matters. Let me give a little, step back and say, most of us, are really proud of Usain Bolt in how he wins his races, in so many different categories, right? And, there's something special about him. But I'm sure a lot of us don't think about the special support that he gets to be able to do what he does. You think about it. What are some of the things that Usain Bolt needs to perform at his best? His coach, his therapist, his meals, the manager, the people who ensures that he can recover, come back. There's a lot that is done to develop Usain Bolt to the ability to perform in his arena. And I'm going to pause there, right? I'm going to come across. Where's our arena as workers? Where's our arena as employees? Where's our arena as leaders? Talk to me. Where is it? Anybody who puts workplace in the chat, you'd have just won a prize, right? Our arena to show our talents is our workplace. But how often does our workplace prepare us as well as Usain Bolt or a Bob Marley or another talented icon is prepared to do their best? Often it's not so. So the approach is important. For us to have environments that's healthy for human beings to function in their optimal state, then we need to put the right thing to work at work, not just human beings, right? The human beings, they do work well, but they work well when something else is working. And let's take a look at what that looks like, right? Now, for those of us who may think that that is just simply about the way they eat and the way they exercise and interact, I'd say yes, you're thinking like 50 years ago, right? That's what most of the things in wellness used to teach us, right? We used to learn that we have to just help the individual to be better. But then there came this thing that we have to help the team to be better. So you had team building. And then, of course, team dysfunctions, you had therapy. But then later on, it's recognized that it's the whole human that we need to bring to work. And so the whole idea is, how do we help the whole human being in a holistic way? Hence the word wellness. Wellness hit the scene for workplaces just over 50 years ago as something that really became a valuable proposition to explore. But what is wellness? Now, I'm very sorry. You can see all of this. I wanted to give you guys trivias to go through, But let me just continue and see where we go with it. What is wellness? Malcolm has said to us, when I is replaced by we, even illness becomes wellness. It's a very simple way for those of us who are not yet familiar with wellness, to get a real connection between what most of our doctors who are in the prior session were talking about. How can we overcome illness? How can we help people to recover better? How can we help people to, be healthy, right? And that's a good thing. But wellness is something more than that. Wellness is about helping people to become what they can be after they're healthy. Let's look at it from one space, being fit. Now, if we can run around our homes and we can do most of our home chores, we can say, yeah, we're fit. But then you might be asked to run up a hill and you say, boy, I'm not too fit. Or you might be asked to carry a load up a hill and you say, boy, no, I can't do that. Or you might be asked to run a marathon and you say, okay, let's make my neighbor do that for me. That's the stages there, that's you increasing in your level of capacity to do more and more physical work. And the same thing goes for different areas. So on the flip side of recovering from illness is where can we grow to? And that space is wellness. So hopefully that gives a very simple way for those of us who are online, who are not yet familiar with wellness. The word literally, the ness in it means being, and the well means good. You can use better in place of good. Being better is what it is. I'm hoping a common way of speaking about wellness is now set. And so for each of you who you might hear many different versions as members of organizations, we hear about the type of exercise classes, we hear about the type of meals, that it's not simply about just simply preventing diseases. It's not just simply about reducing the amount of the chance that you get a stroke. That's for the medical team that was on before. My team is about helping you to transform your capacity into the best you can possibly be in every single aspect of your being, whether that be physical, emotional, mental, financial, spiritual, you name it. How can we help you in every part of your being to be at your best? And that's the journey of wellness. So I'm going to help you through the next couple of slides. And because I'm going to preempt what's going to happen with the slides, I'm going to see if I can help us to converse a little bit, because I do like when we converse. And thank you so much. Sharpen the saw is what we need to do every day if we're going to be our best. So you guys have heard about what wellness is. We hear about where we want wellness to take us, being the best place to work, not just competing with our more developed regions that are able to give twice the salaries that we can give, but to find ways, just like Usain Bolt and Bob Marley and so many, great icons have come from the Caribbean. How can we create an iconic place to work by tapping into the talent that we have to be able to design and develop spaces that people become their best? The challenge that I'm putting to you is that we can use workplace wellness, and this is what the team at JAXA is asking you to look at. How can we create service excellence that goes above and beyond? And if you understand what wellness is, and I'm hoping you understand it now, then you should be able to give me, for a quick prize, what's the difference between wellness, helping someone to blank, versus helping someone to be healthy? What's the difference between wellness and helping somebody to be just healthy? Drop it up in the chat for me. We want to help someone to be blank. Drop it in the chat for me. Let me see if everybody understands the concept of wellness as we're looking at it in the context of making our country's workplace the best place to work. So, question. You guys, if you can't hear me, or if you're breaking out, please let me know. So with wellness, we become our blank versus when we're healthy. What's that blank? We focus on helping people to become their blank. Ah, thank you, Talicia. All right, so Talicia deserves a prize, so we're going to help. We're going to provide a prize for Talicia here, right? So we're helping someone to become better. We're helping people just preventing diseases. We're not trying to just simply here. Can you hear me? Better self. All right, you guys are spot on. Spot on. Someone help me. Oh, yeah, my picture is no back. Can you guys hear me clearly? Best self. Love that, Kerry. Right? Awesome. So we're all in the same vein of what we're trying to do in our workplaces when we're trying to develop service excellence that goes above and beyond, right? Where we're no longer focusing on what's wrong with us, but we're focusing on what's strong with us, right? All right, hearing. Thank you so much, Dion. So let's jump. So the aim with wellness is distinctively different from just simply what we tend to do as HR functions, right? Helping somebody to overcome a frustration at work. We heard about EAPs earlier. Yeah, it's not simply about just simply having somewhere that someone can get a rescue. It's how can we help people to become their best. And so at the top of, if you can see my slide at the top here, and I don't know if you can see my pointer, but hopefully you can see my pointer, right? At the top, this is what we tend to try to do every day. Try to do what we're asked to do and try to be normal, right? We're trying to do the norms. We're trying to compare, keep up with the Joneses, you know. Are we any better than, you know, the people across the way? And yes, we're healthy. We're doing okay. We are good. We're a good company. We're a good person. We're a good team member. That's not what wellness is about. Wellness is about taking what we already have, wherever we are in our comfort zone, and push in us to become, or, you know, to become what is our ultimate capacity, which is becoming our best. So I see we lost some of this here. All right, we'll still work with it. So we're able to flourish, we're able to thrive, we're able to unleash our best potential, right? And this is what happens when we get to our optimal state of health. We're able to unleash our full capacity, but of course, in different ways. Essentially, what this slide is saying to you is reminding you that most of the things that we think that wellness does, helping people to be better, prevent diseases, you know, that's good. That makes you healthy. That's a prerequisite to now start working on the other side. An interesting thing is that what you find, just like with people who develop their fitness level, people who are fitter get less sick. People who are fitter get less heart disease. People who are fitter tends to have better relationships, right? And so we find that the just working at becoming your best selves eliminates a lot of the challenges that you find from illness, dysfunction, disorder, disease, and so forth, right? A lot of the things that you have to be, you know, trying to close the gap on, reduce those problems, a lot of those things disappear just by working towards thriving, flourishing, balanced, holistic living. I'm hoping the outcome difference have sunken in. Another thing that's distinctively different, and I'm sorry about the slides, guys, I just have to work with it as it is that not just the outcome is different with wellness, but also the methods are different. The way in which you work at it is holistic. It's strategic and systematic. What do we mean by this? Let me give you a simple example. If you should plant a plant beside a river, it will bloom into a beautiful tree. If you plant a plant in a desert and leave it without any further nourishment, it dies within hours, if not days. That's the same thing when it comes to wellness. Think of your wellness initiatives, your wellness efforts, like planting a plant beside a river. It needs a number of things to make it sustainable. It needs strategy, structure, culture, climate, environment. This is the way in which the methods by which wellness actually works. It's not something that you can pull somebody out of environment, send them to a doctor, get them a couple of pills, and then you take them back and push them into the office at work. And yes, you know, you're better, you're healed, you can now go and go work. Wellness is not like that. You can't send the person out and say, hey, go to the gym and exercise and then come back in this toxic space and just be fit and functional as you sit down for 8 hours of the day in a sedentary lifestyle. It turns out, as studies show, that sitting is the new smoking. And so what we were trying to prevent with smoking, we get with sitting. As you sit for 8+ hours of the day, you know, you send them to the gym for the half an hour in the morning, but when they come back into work, they're sitting down. That benefit got depleted by them just continuously sitting. So in the spirit of wellness, I invite you all to stand and stretch now, right? Because you guys have been sitting for about half an hour listening to me. So let's all just get out of the stretch. Stretch to the sky. Stretch to the side. Twist a little bit. Twist a little bit. It's a reminder to us. Oh, we stretch and touch our toes if you can. Just go as far as you can go. It's a reminder for us, you know. The methods and approach with wellness is different. All right? So the methods are different. Lastly, the language is different. The language of wellness is different. Thank you so much for laughing, Leon. The language of wellness is different. So guys, I'm sorry about the slides again, but you know, I just have to work with it. You know, you think about your workplace. What are some of the things you want wellness to do for you? Reduce stress. I hear it all the time, right? I want wellness to help us to relate to each other with less conflict. You know, we want it to work for us that way. But of course, that's the language of prevention. That's the language of closing the gap, deficit language. The language of wellness speaks to what we want to achieve versus what we want to get rid of. All right. It speaks to us achieving our best self. So an example here from British Airways, they wanted to prevent baggage loss, but they changed the language to say, we want exceptional arrival experience. Their employee engagement went up, their customer engagement went up by just shifting the language. So with wellness, we don't say we want less stress at work. We don't say we want less sickness at work. Somebody put in the chat, what do we say? Yes, we definitely want less conflict. Definitely, Sharon, right? Definitely we want. But remember, as we said, just like people get fitter, even if you don't work at the direct stress itself, you will help everyone to become more capable to navigate stress by helping them to develop resilience, ability to flourish, a greater level of well-being. What you find, it automatically eradicates the challenges that you're trying to solve. And I'll show you this in a slide further down. You get to understand it a little bit more. But the key to just remember, the language is different. So we don't say we want a workplace that is stress-free or sickness-free. What we say is that we want a workplace that is happy, full of life, thriving. That's what we say. That's the wellness mission set out there. And when you have the language right, then now you're ready to do wellness. And this is what wellness does when you do it right. When wellness is done right, and again, the slides, but let's go at it. It promotes your company developing. Your company becomes a developed company. It becomes more aware of itself. It becomes more goal-directed and less distracted by the problems that it faces. Your company can achieve its potential. Your service team can be exceptional. And of course, you have a better sense of your identity. All of these come through positive emotion, engagement, you're in flow, relationships that you have high quality connections, meaning where work is not just simply about a paycheck, but it's about building out in a meaningful way your strengths being used to serve and add value in transformational ways. You accomplish great things. And of course, you have better health. You know, these things just come together to be transformative. For those of us who's interested in the finances of it, you know, read these books, Firms of Endurement, Sustainable Value, Better World, and you'll see that companies that focus on wellness-oriented initiatives, whether that be ESGs or otherwise, they outperform other companies that don't. I won't even go through it for you. The stats is all there if you go Harvard Business Review or otherwise to show that it makes a tremendous difference to the traditional bottom lines. So hopefully everybody is convinced. And You know, I'm sorry that I've not been able to give away more prizes, but I'm sure where we want to go now is how can we do this? How can we start today to actually put wellness to work in such a way that our country, our respective countries, become the best place to work? I think I go back to where I start, which is just try it out. Try out the wellness, right? Try the appreciative exercises, try the mindfulness exercises, and allow people in leadership levels just to try these things experientially. And the experiential benefits of them really speaks to it, is a testimony to the power of what we can achieve when we actually start things well and we end things well. Start our meetings with just a moment to reflect. Throughout our meeting, pause to just take a deep breath to stay focused and less distracted. Close our meetings with what we appreciate. Just try it out. I think that's the first place to start, right? And I believe if you just try it out, then we can move to the more sophisticated part of things. Again, sorry for the slides, but we'll work with them. We can get to the drivers of wellness, right? What really drives wellness. And I'm going to be this is where I really want to ensure that we take this one back to our workplaces, right? Too many times I've heard in workplaces that, we want to do what the next company doing. We want to get their awards. Remember what we say. Wellness is not about comparing. It's about what you are good at and what's going to work for you. So what's going to work for you is not necessarily a gym. What's going to work for you is not necessarily the next big therapist that can come on site and tell you, very big motivational lines. What's going to work from you is going to be what you need to get your unique organization to work well. And so you're going to have to figure this out. Yes, you'll need to look at the actual data and say, okay, what's out there, right? Learn a little bit about the space, right? So you learn about the dimensions of wellness and so forth. But don't just get up and say, hey, okay, we need some exercise classes tomorrow. No, I ask you to dream a little bit first. And I want you to come back to the slides when you get the slides and read this invitation that says, recall a high point time at work or in your career when you felt full of life, energized to work at your best, and you are making a difference. Remember that time. And when you can remember that time, share that story with colleagues in your department, share that story with people across your workplace, and hear what they say. Write down what they say, because chances are you're going to hear them say something like this. Now, every company is going to share a different one, but you will hear things like this, right? But in different ways. We are at our best when we work in oneness. We are at our best when we feel ready for tomorrow. We feel confident and bold. We're at our best when we live in a way that we can take care of ourselves. We're at our best when we are in harmony. We're at our best when we lead and work in positive ways and positive spaces. When we love what we do, we're at our best. Now, we hope for you will listen to the people who are in your workplace, and then from there, choose the things now that you need to work on. Because in choosing the things you need to work on, you will now be on the right path to positive deviance for you and what's uniquely strong in your organization, in your country. You'll discover the things that you're good at. I think Usain Bolt started running in the distance races and in the 400s. And then he realized that, after change, that he was extremely good at the 100s and 200s, right? He switched over to what he was good at. And that's what we're saying. Not because you're tall and lanky means you're going to be a distance runner, right? Tall and lanky doesn't equate to distance runner everywhere. As Usain Bolt proved that I can be a sprint runner, though I'm tall and lanky, right? And no this to you, Usain. You're my boss, right? But each of you are different. And so you have to know what will work for you to drive wellness to work for you at work. As much as you get to know the things that drive wellness globally, like the dimensions of wellness, the things that drive flourishing, and so forth, right? But I'm hoping you get the gist. And I'm so sorry I don't get a chance to get you involved. Really, I am. But let me see if I can get something that can give somebody else a prize. Now, if you know your drivers, then you know, need to apply it to something that's of value to your company. For us, for this conference, we're looking at service excellence, right? So service excellence may be the strategic value for your company, and say, I need to apply these things that have driven people to feel well and function well at work to know this outcome. So let's drop in the chat the things that you recall when you think about your best service excellence experience. I've given some starters there, warm and welcoming. The person went above and beyond. Drop in the chat. What are some of the things that comes to mind when you think about your best service excellence experience? Drop that in the chat for me. I'm going to ask somebody to help me with my time. I think I've lost track of my time a little bit here. Drop it in the chat for me, please. Okay, all right, wrap up. Thanks. Awesome. So there was empathy, there was listening. Awesome. Now, for all of you who mentioned those things, and you're going to go back to work now to say, okay, we're going to build wellness to work for us for service excellence. You have to remember now, the people who are going to deliver this for you will need that exact same treatment. They will need active listening. They will need smiles. They'll need responsiveness from you in your organization for it to come out, right? And if you hold on to that message, then you can now start to connect the dots to the things now that sit behind the scenes, the things that you heard, whether you heard resilience, positive emotion, whatever you heard, right? The important thing as an organization, for service excellence to work, we have to realize that there's a lot of human work being done, whether that is the type of interactions, the labor, and what we do repeatedly, we become, right? As Aristotle says, excellence is not an act, but it's habit. And so if we constantly do emotional labor with no doing of the things that help us to move forward, which were from the prior slides, right? Then of course, what we're gonna get is a lot of what we experience that depletes service excellence, stress, depression, so forth, right? And so if we're gonna do this and make our wellness work for us, we need to prepare and put the things in place. Otherwise, as Benjamin Franklin says, by failing to prepare, you are preparing to fail. So in wrapping up, there are many methods out there for implementing wellness. I'm just putting on the screen one for you. This is a 7 benchmark. We implement this on behalf of the Wellness Council of America as one of their exclusive partners in the Caribbean. But there are many methods, right? That gives you a process for implementing that start. I've shown you the start a while ago. Now, I said earlier that I would give you the things that will actually bring out that effective program. A lot of times, because we tend to focus on the things that we need to do, we miss the things that make those things work. It needs to be a part of your strategy. Your organization has to be structured around wellness systems working. I gave the example a while ago of someone going out and exercise and coming back to sit down for 8 hours. But there's also, someone being constantly engaged at work without having that 1 to 2 minutes to breathe in between. Even better, 5 to 10 minutes to breathe in between. And you have somebody who's constantly depleted because our work processes aren't designed to support effective human, let me say that word again, human functioning. And so our processes need to be there. Our leadership styles need to represent it. We can't just have, transactional leadership. We need transformational leadership, inclusive leadership, positive leadership, servant leadership styles being mastered by our leaders. And when our leaders can master those styles, then you'll find that you get the rest going. So for each of you, it's been a journey to get to this slide, but I hope that you have picked up something interesting that at least tickle your thoughts. Tickle your thoughts about, can we have the best workplace anywhere? Can our workplace, can our country have workplaces that are the best anywhere? And I'm hoping for each of you, you've seen at least a light that gives you hope that it's not just about comparing ourselves to what others are pulling from us, but to create the space by what we are strong at, not just what we have as wrong or what we cannot do. So as you look to get the juices going and to build an exceptional wellness system in your organization, just hold on to first beginning with having a clear understanding of what wellness is and what you'd want wellness to do for you. Hopefully from this conference, service excellence is one of those things that you'll strategically decide upon or help your leaders to strategically decide upon. And then once you've gotten that start, we're there to walk you through the rest of it. So let me just pause there, open the floor for questions. I've been talking for a long time. So let me just allow you guys to share questions, comments, and let me see if I can help you, because hopefully I've helped you to think a little bit about workplace wellness a little bit differently and how service excellence can go above and beyond if you focus on what you are positively deviant at. All right, back over to my tech team to take us away. Sorry, my team members to take me away into questions. Oh, hey, how's it going?
Dr. Thompson, that was absolutely.
I'm sorry, Atia. I mean, I really wanted to, get everybody a little bit more involved, but.
Oh, it was excellent. And there was so much activity in the chat. It does show that what you shared was impactful. It was absolutely fantastic. In fact, I was saying to Dwayne, sitting here with me, that listen, man, I'm just into this wonderful state of relaxation now after that little exercise that we started us off with. And I think perhaps all of us should start our day like that. And then once I was finished with it, I felt very energized. And I have a feeling that that is how everyone felt. One of the things that you said that I think resonates with me is that the workplace, your bosses really should be treating each worker, or something that you shared, I think that was from Stephen Covey, each worker like in much the same way that they would want that worker to treat their best customer. So the internal customer is really very important. How do we get our workplaces though to buy into that kind of narrative, Doug?
Yeah, so ultimately, as a Caribbean and as a country, we have to know what we want, right? We know back in slavery days, we wanted out of slavery. And, right now, a lot of people talk about economic slavery. We'll talk about, the challenges of competing with the broader world. And so if we really want to achieve the ability to stand in our own space and not constantly be under the shadow of the broader world, but being like the icons that have set a light in the world, you see it about Barley and so forth, we'll have to recognize that that's just where we have to go. Wellness is just not, exercise, broccoli, and social chats. It's just not. And so if we're going to really make these things work for us, then we have to see our employees as our real best asset and treat them as we'd want to have our best customers treated.
Yes, definitely. I see so many comments being dropped in the chat. Talicia Morgan, who, by the way, we have to congratulate because she won the wellness prize, the workplace wellness prize. And she says, what's the role of the individual employee as it relates to workplace wellness?
Yeah, very powerful. It is one of those things a lot of times that we tend to look at the us versus them. What should we be doing versus what our employer should be doing? And of course, as each and every one of us know, we might be brought up in our home and our parents take care of us, but we are responsible for becoming a responsible adult. It's not just our parents that's responsible for that. It applies in the workplace just the same. It's not just our leaders, it's not just our companies that's responsible for us to be healthy and well, to become our best. We are the first steward of that responsibility. And so we must ensure that we champion in a very responsible way our own well-being and ensure that we first be the best as we look to work in the best places.
All right. Dion Taylor Wilson says, we all have our strengths, and if we work together and appreciate each other, then I know that it will feed into dealing with others excellently. Also, leaders need to learn how to find innovative ways to empower their staff.
Indeed. And, I would say, Althea, we tend to put a lot of need on each other, but I would always say we need to do it, right? Because it's not just my leader. It's a dual relationship that we are connected together, right? So we are doing it. Though my leader needs to ensure that the resources that are necessary are discussed, but it is us that champion this together. It's, as we said, when the I replaces when the I replaces the we, when I is replaced by we, then illness becomes wellness. So we in wellness says we do it together, right?
Okay. Now, if we were in a physical space, I know people could have walked up to you and they would have asked the question that I'm about to ask. How does one get in touch with you?
Well, so easy through the JAXA team. I'm closely connected, so you can always feel free to reach out. But if you'd like a email address, you can use wellness@wethriveatwork.org. That's wellness@wethriveatwork.org. But I'm pretty close to the team that leads this excellent conference.
All right, thank you so very much, Dr. Thompson. Excellent way, Dr. Nsambi Jaja noted earlier, to end this first day. And what a day we have had. Listen to me. We could end with day one, and not do day two. That is how good day one has been. It has been absolutely fantastic. And can you imagine tomorrow? What tomorrow will bring? I want to congratulate you all, because one of the things that you did, which was really very good, was to participate in the online chat, and we absolutely applaud you for that. Kerry Shaw Walker says, I love this for Jamaica. I can truly say this conference exceeded my expectation, and this is just day one. Great job, Team Jamaica. And I think that many others are sharing that sentiment at this time. Really, let me just use the opportunity to say thanks, first of all, to our sponsors and our partners, the Public Sector Modernization Division in the Ministry of Finance and the Public Service, the R.J. Ardina Communications Group, the Jamaica Cultural Development Commission, the Private Sector Organization of Jamaica, PSOJ, Rhythm FM, Caribbean Center for Organization Development Excellence Limited, CARICO, National Commercial Bank Jamaica Limited, NCB, Bank of Nova Scotia Jamaica Limited, the Jamaica Public Service Company, JPSCO, VM Group, National Housing Trust, JMMB Group, National Health Fund, Guardian Life Jamaica, Jamaica National Group, Burke's Auto Parts Limited, the Tourism Enhancement Fund, Restaurant Associates Limited, the Bone and Joint Center, and JN Fund Managers, and we say thanks as well to Mr. Terrence Lawrence. This has been an absolutely amazing day. We opened the conversation this morning with Sandra Glasgow, who spoke about the customer service reputation of a brand, and how you should make your customers feel good, because that will determine if they come back to you. It is very important. David Mullings said excellence is a choice. Every single day, you need to make at least one person smile. That's what he does. He says, start with empathy. We should be aiming to have people say this is the best customer service. And it doesn't matter the organization that you are in. Leslie Fook spoke about the whole issue of appreciative inquiry, and that 5-step process: defining, discovering, dreaming, and of course we have to design, and then we move to our destiny, pointing out that it is not AI that will replace you, but the people who use it. And of course, we had some other wonderful presentations. We had Carleen McKenzie Spencer spoke about promoting a culture of excellence from policy to performance. The culture of excellence that focuses on customer centricity, culture of performance excellence, and service must be designed and delivered in a way that provides benefits to all customers. Andre Holness spoke about the right of choice, the right to choose. The data protection system that they have worked so hard to put in, and they're continue to work to ensure that we're able to leverage that data for our protection. Yes, very, very important. Data protection, she notes, will assist in accomplishing Vision 2030. And then we had Justice Sykes, who so effortlessly highlighted the role of the judiciary in the narrative of excellent customer service. And indeed, Justice Sykes has been at the forefront of the work to get the court system up to date more efficiently. Then we had our team of doctors who spoke about the really interesting ways, the various ways that AI is assisting in healthcare. Machine learning, machine vision, natural language processing, and robotics. And that there is that paradigm shift that will lead to improved diagnosis and treatment. Absolutely excellent. And then what an amazing way to round out day one. Dr. Aja Thompson. Listen with ears of tolerance. He quoted Rumi. See through the eyes of compassion. Speak with the language of love. Says what is strong and possible is a light that guides and energizes us. And the purpose of work is often found in the pleasure of using our strength to help others. What a beautiful way to end this day. Our work environment is only going to be healthy for human beings if we are working together. The approach that you take matters greatly, he says. And then he quoted Stephen Covey, always treat your employees exactly as you want them to treat your best customers. We have had a fantastic day one. Believe you me, I'm excited about day two. I think I should just stay here. Dwayne is saying, no, you can't stay here. You need to go home to your husband and your daughter. But it has been an absolutely fantastic day. Richard Rowe says, excellence activated. Love the lineup. We take it above and beyond indeed. Nicola Louis Williams, and I hope I got that right, says, such an impactful conference. Presenters were wonderful. Oh no, one good JAXA top tier conference. So friends, day one has ended. Go home with all of this mindfulness and take yourself to that place where you're preparing for tomorrow. Tomorrow is important, but remember to live in the moments that you have now. Mwah! See you tomorrow. Enjoy the rest of the evening.
This is one of the customer service people, them like this. Taxi man and Kenny, yeah, them help me out on a daily. Them work them 9 to 5 to make Jamaica alright. They'll be the magic to make Jamaica alright. Give thanks to the customer service people, them will make Jamaica nice. Work day and even night, make sure the service done and all the customers alright. Just give thanks to the customer service people, them will make Jamaica nice. Work day and even night, make sure the service done and all the customers alright. It's just a blessing for have them now in life. We make Jamaica proud and we know Jamaica is a very special island filled with attraction, like the music and its food. So it's up to them to sell the island to the masses, providing great service and be polite while them at it, yeah. And that's the #1 aim, so if them loyal, just call them by them name now. And give thanks to the customer service people, them will make Jamaica nice. We work day and even night, make sure the service done and all the customers alright. Just give thanks to the customer service people, them will make Jamaica nice. Work day and even night, make sure the service right. We say you have to keep your manners, you have to keep your honor. Even the Rasta man we sell the jelly panic and I know this is my system. Look out to what you preach. We say we practice, we preach now. Out them, we say Jamaica's not a nice place. Everybody help a brother, no matter the race. Everybody have to nice up the place. Even the taxi man we keep a smile on him face. Give thanks to the customer service people, them will make Jamaica nice. Work day and even night. Make sure the service done and all the customers are alright. Just give thanks to the customer service. People them will make Jamaica nice. Work day and even night. Make sure the service done and all the customers just give thanks. 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 Yeah. Be the magic in J-A-A. Just give thanks. Just give thanks. Just give thanks. Just give thanks, yeah. Be the magic in J.A. land, you know. Make everybody just give thanks, give thanks, give thanks. This I want you for the customer service. People, them like this. Doxy Man and Kenny. Yeah, them help we out for a daily. Them work them 9 to 5 to make Jamaica alright. They'll be the magic to make Jamaica alright. Give thanks to the customer service. People them will make Jamaica nice. Work day and even night. Make sure the service done and all the customers alright. Just give thanks to the customer service. People them will make Jamaica nice. Work day and even night. Make sure the service done and all the customers alright. It's just a blessing for happy now we life. We make Jamaica proud and we know Jamaica is a very special island filled with attraction, like the music and its food. So it's up to them to sell the island to the masses, providing great service and be polite while them at it, yeah. And that's the number one aim, so if them loyal, just call them by them name now. Give thanks to the customer service. People them will make Jamaica nice. Work day and even night. Make sure the service done and all the customers are alright. Just give thanks to the customer service. People them will make Jamaica nice. Work day and even night. Make sure the service right. We say you have to keep your manners, you have to keep your honor. Even the Rasta man we sell the jelly panic and I know this is my system. Look out to what you preach. We say we practice, we preach now. Out them, we say Jamaica's not a nice place. Everybody help a brother, no matter the race. Everybody have to nice up the place. Even the taxi man we keep a smile on them face. Give thanks to the customer service. People them will make Jamaica nice. Work day and even night. Make sure the service done and all the customers are alright. Just give thanks to the customer service. People them will make Jamaica nice. Work day and even night. Make sure the service done and all the customers just give thanks. 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 Yeah. Be the magic in J-A-A. Just give thanks. Just give thanks. Just give thanks. Just give thanks, yeah. Be the magic in J.A. land, you know. Make everybody just give thanks, give thanks.